Hi, and welcome to Cenario, your partner in mental wellness. Here on our channel, we share educational, insightful, and science-backed content to help you understand your mental health and take meaningful steps toward a more balanced life. If you're ready to learn, grow, and take control of your wellness journey, let's jump right in.
So today, we're going to dive into a really powerful and, let's be honest, pretty controversial way to change human behavior. It's called aversion therapy. We're going to break down how it works, where it's used, and get into the serious debates that it always seems to spark.
You know that feeling, right? We've all got habits we wish we could just stop. But sometimes willpower just doesn't cut it. So what if you could actually rewire your brain to genuinely dislike the very thing you can't seem to quit? Well, that's the wild idea we're going to explore. All right, so here's our game plan. We'll start with the basics. What is this therapy? Then we'll look at the actual techniques they use. After that, we'll see where it's applied and if it even works before we get into the really sticky ethical questions. And finally, we'll figure out where it fits in the big picture of mental health today.
Okay, first things first. What in the world is aversion therapy? And where did this idea even come from? So at its core, aversion therapy, sometimes called aversive conditioning, is pretty simple, really. It's a type of treatment that gets you to stop doing something by pairing that thing with a really negative, unpleasant experience. The whole goal is to create this powerful, almost automatic feeling of, no thanks, toward the habit itself.
And this isn't some newfangled idea. Its roots go way back to classical conditioning. You've heard of Pavlov's dogs, right? Well, instead of associating a bell with a tasty treat, imagine teaching your brain to associate a bad habit, like smoking a cigarette, with a deeply unpleasant feeling. It's the same principle, just in reverse.
And listen, this is a really crucial point. The goal here isn't to punish someone for what they're doing. It's all about hijacking the brain's reward system. The therapy is designed to strip the pleasure away from a harmful habit and replace it with a bad feeling, hopefully breaking that cycle for good.
So how do you actually create that unpleasant link? Let's get into the main techniques that are used.
First up, you've got chemical aversion. This is one of the most common methods, especially when you're talking about substance abuse. A person takes a specific medicine that, by itself, doesn't really do anything. But if they then consume a substance like alcohol, that medicine triggers a really powerful and awful physical reaction.
All right, next is a technique that is, for sure, highly controversial: electrical shock. In this case, a person gets a mild, uncomfortable, but not physically harmful electric shock at the very moment they're doing the unwanted behavior. The idea is to create a super direct physical reason to stop.
Now, this next one is fascinating because it happens entirely inside your mind. It's called covert sensitization. A therapist guides the person to vividly imagine doing the bad habit and then immediately picture some awful, repulsive consequence, like getting violently ill or feeling this deep sense of public shame.
And finally, there's taste and smell aversion. This is a much more direct sensory attack on the habit. You know, like putting that nasty, bitter-tasting polish on your fingernails to stop biting them, or maybe a foul substance on a cigarette. It just makes the act itself physically gross.
Okay, so we've got the theory, we've got the techniques, but where is this stuff actually used, and more importantly, does it even work?
Let's use alcoholism as a perfect example. A patient takes a medication, say disulfiram. If they decide to drink alcohol after that, the reaction is fast and it is severe. Over time, their brain starts to forge this incredibly powerful new connection. Alcohol now means feeling violently ill.
And we're not talking about a little bit of discomfort here. We're talking about intense symptoms like nausea, awful headaches, chest pain, even trouble breathing. It's the sheer severity of this reaction that makes the conditioning so powerful and such an effective deterrent.
But it's not just for treating alcoholism. Aversion therapy has been tried for a whole range of compulsive behaviors. Everything from smoking and nail biting, all the way to gambling addiction and compulsive eating. The core idea is exactly the same, no matter the habit.
So look, when this therapy works, it can work really, really fast. The change can be dramatic. It acts as an incredibly powerful deterrent, and for some severe, life-threatening addictions, that kind of rapid change can literally be a lifesaver.
Okay, but, and this is a huge but, we absolutely cannot talk about aversion therapy without getting into the major ethical issues and its limitations. This is where the whole story gets a lot more complicated.
There are some very, very serious ethical problems here. You've got a real risk of causing psychological harm, maybe even trauma, and historically, these techniques were misused in deeply unethical ways, most infamously in so-called conversion therapy, a practice that is now widely discredited and condemned.
And even beyond the ethics, there are some big practical limits. Aversion therapy only targets the behavior, not the reason for the behavior. It doesn't do anything to address the underlying depression or anxiety that might be driving the habit. Plus, if you take away the negative stimulus, the behavior can just come right back.
So all of this brings us to our final and maybe most important point, understanding where this therapy actually fits in today's world. It's really best to think of it as one very specific tool, not some kind of magic cure.
A great way to get it is to compare it to something like cognitive behavioral therapy, or CBT. Aversion therapy basically uses a sledgehammer, a negative stimulus, to just stop a behavior in its tracks. CBT, on the other hand, works to change the thoughts and beliefs that are causing that behavior in the first place. So one is for a quick stop, the other is for long-term deep change.
And that's exactly why the modern approach is all about integration. Aversion therapy might be the thing that stops a dangerous behavior right now, but it's way more effective when you combine it with something like CBT to fix the root problem, plus some solid strategies to make sure the person doesn't relapse.
This quote just nails it. The therapy can be the thing that kicks off the change, the thing that gets the ball rolling. But if you don't have that ongoing support, that counseling, and a plan to prevent relapse, that change probably won't stick. The follow-up care is every bit as important as the treatment itself.
And so that leaves us with the big central question. When someone is trapped in a really self-destructive cycle, is deliberately making their habit feel awful an ethical or even effective way to help them break free? It's a question without any easy answers, and it really gets to the very heart of this incredibly complex therapy.
Thank you for watching Cenario. If this video helped you, don't forget to like, subscribe, and share. For personalized mental wellness supplements, visit Cenario.com. See you in the next one.